My name is Emily Thompson. I have primarily worked in a primary care clinic in my 9 years of nursing. I chose Mestinon because my mother-in-law went through a very big scare with myasthenia gravis that developed into myasthenia crisis about 2 years ago. Myasthenia gravis is only discussed very briefly in nursing school, and I have learned so much more since she was diagnosed. I tried to complete projects over medications or diseases that myself or close family and friends have so that I become more familiar with them. Action and indications of pyridostigmine. Pyridostigmine is in the indirect acting cholinergic agents drug class. It inhibits acetylcholinesterase in the synaptic cleft, which then slows the hydrolysis of acetylcholine. This allows the buildup of ACH released from the nerve endings, which then leads to increased and prolonged stimulation of ACH receptor sites at all of the postsynaptic cholinergic sites. This process will relieve the patient of myasthenia gravis symptoms and increase muscle strength. This medication is also beneficial in military personnel who have been exposed to nerve gases to reverse paralysis and prevent death from prolonged muscle contraction. The usual indications of pyridostigmine are management of myasthenia gravis, an antidote to neuromuscular junction blockers, and is used to increase the survival rate of people exposed to nerve gas. The usual dose and administration of pyridostigmine. The forms of pyridostigmine or Mestinon that are available are syrup, conventional tablets, and time span or slow release tablets. The average dose of Mestinon is 10 60 milligram tablets or 10 5 milliliter teaspoonfuls daily. The dose for slow release tablets is 1 to 3 180 milligram tablets taken once or twice daily. Side effects and adverse reactions. Common side effects of Mestinon include stomach pain, nausea, vomiting, diarrhea, muscle cramps, twitching, sweating, increased salivation, cough with mucus, rash, or blurred vision. You should stop using pyridostigmine and call your doctor immediately if you notice serious side effects such as extreme muscle weakness, loss of movement in any part of your body, weak or shallow breathing, slurred speech, vision problems, or worsening or no improvement in your symptoms of myasthenia gravis. Nursing interventions and implications. Patients should take this medication 30 to 60 minutes before a meal to help increase muscle strength with swallowing and chewing. Monitor for myasthenic crisis from not enough medication or cholinergic crisis, too much of the medication. Both will have respiratory failure and severe muscle weakness, but from different causes. Signs and symptoms of cholinergic crisis are similar to the parasympathetic nervous system being in overdrive. These symptoms include pupil constriction, bronchoconstriction, increased salivation, and mucus production. Patients may also experience GI symptoms, bladder incontinence, or slowed heart rate. Treatment for cholinergic crisis would be to discontinue anticholinesterase medications and administer atropine to reverse the symptoms. Pyridostigmine should not be used if the patient has a bladder or bowel obstruction. Patients should not chew, break, or crush an extended release tablet. It should always be swallowed whole. Store medication at room temperature, away from moisture or heat. Take the missed dose as soon as you remember, as long as it is not almost time for the next scheduled dose. Do not try to make up missed doses. The timing that this medication is taken is very important. Client education and compliance promotion. Educating patients on the importance of taking pyridostigmine as directed is crucial to their outcome. Helping them to set repeating alarms on their phones to remind them to take their medication might help. Putting medications into pill boxes, asking the doctor to prescribe a 90-day supply, and having the pharmacy put medications on automatic refill may also help with compliance. Medication interactions. NSAIDs pose an increased risk for a GI bleed, and cholinergic medications decrease the effect of Mestinon. Cellcept, Advil, Cymbalta, aspirin, clonazepam, gabapentin, levothyroxine, lisinopril, Lyrica, metformin, midodrine, omeprazole, prednisone, Singulair, tramadol, trazodone, vitamin B12, vitamin C, vitamin D3, and Zofran are some of the medications Mestinon can interact with. Mestinon should be taken only as prescribed during pregnancy. It is not known whether this medication passes into breast milk. Always consult your doctor before breastfeeding while on Mestinon. Also, medical conditions such as bradycardia, bronchospasm, coronary artery disease, Parkinsonism, peptic ulcer disease, seizures, and hyperthyroidism are medical conditions that Mestinon could have a negative effect on. Cultural, ethnic, and spiritual considerations. There are no ethnic, cultural, or spiritual considerations mentioned with Mestinon. You should always ask patients personally if they have any beliefs that could interfere with treatment using Mestinon. Cost ranges from $34.99 to $38.20 for a 30-day supply of Pyridostigmine 60 mg TID using a GoodRx coupon. This is for patients without insurance. With insurance, patients typically just have a copay as long as this medication is on their insurance formulary or a prior authorization is approved. Brand name Pyridostigmine, Mestinon, is much more expensive and would likely require a prior authorization through insurance. In summary, pyridostigmine is used to increase muscle strength in patients with particular muscle diseases such as myasthenia gravis. It prevents acetylcholine from breaking down in your body. Acetylcholine is needed to sustain normal muscle function.